Hey everybody, this is Dr. Zappy from the Wellness Center of Chester County, again coming to you with another video here. This one is a cyclist, and it's a video that I want to focus on a common theme among cyclists, which is called a hip drop. This time it's actually in their left hip. So this generally occurs when there's an asymmetry in the body. We basically are trying to perform a symmetrical activity on a bike, which is a symmetrical system with an asymmetrical body, and things kind of go awry. So what I want to show first is an area that we're not really supposed to be concentrating on, which would be the shoulders. I think there's a significant amount of upper body sway, as we just demonstrated, and this comes from a lack of core control and a lack of scapular stability. So if nothing else, gaining stability in the shoulders will help with power generation, control, and endurance. More importantly, I would expect that gaining scapular stability will improve propellant mechanics as well. We can clearly see that there's a significant amount of rotation to the right side when the left leg is in the downstroke, as you can see here. And something to check in relation to the shoulder would be a lack of flexion, abduction, and internal rotation in the left shoulder. If a mobility restriction here is determined to be muscularly related and not glenohumeral or scapulothoracic or spinal or any other type of joint related, the muscle primarily involved with this would be the latissimus dorsi. So a good time, this would be to bust out the foam rollers, lacrosse balls, and all your active releases and things like that. So the reason that is because the lats, as you can see here, they attach from the shoulder. They go into the thoracolumbar fascia, which is the squiggly lines there, and then they attach to the opposite gluteal muscles, forming this X pattern. So mobility restrictions in the left shoulder could present with a classic case of opposite shoulder and hip mobility restrictions. I would not be surprised if there was some type of a mobility restriction here in the right SI joint. And the right SI joint mobility restriction can also become a functional leg length discrepancy. This would again present as a functionally short right leg having a asymmetrical body on a symmetrical system, which causes compensation patterns more or less. So with such a significant mobility restriction, that loss of movement has to be compensated somewhere else. In this case, it's a left hip drop. So of course, these are just some ideas from a general fit video. So we need to confirm them with further evaluations and palpation and things like that. But from a movement perspective, it's very wonderful to have a movement assessment as a way to start the search for the most valuable area to treat. And this way, we don't waste time in the treatment. I could waste time on a client where it hurts all day long, but fixing the problem isn't really going to be any faster if we don't do a movement assessment. So this is why it's so important to get a very valuable movement assessment from your movement specialist. There are a lot of other things going on in this video that I could talk about all day long, but if you have any questions, please like, subscribe, and comment, or if you need to send me an email, it's joezappydc@gmail.com, or you can visit our website at wcofcc.com.